Just sort of waiting. Hello, good evening, everyone. We hope that you have a great session this evening. My name is Dr. Paula Henry, and I am an associate with Rico-Medical. And today I want you to relax because we're going to have a great session. We are going to talk about respiratory illnesses. And this is probably our fifth or sixth production in the Caribbean Climate and Health Workshop series that started last year, October. And and next slide, please. And so I want to honor my partners, that is the Columbia School of Public Health, the Global Consortium on Climate and Health Education, and of course my organization, Rico-Medical, and the Healthy Caribbean Coalition, who are partners in this production. Next slide. And so our learning objectives for today: to highlight the connections between climate and environmental changes and the development of respiratory illnesses, and to discuss how the home and community environment is a type of microclimate that impacts respiratory health. We're also hoping that you'd understand better air pollution as a cause of death and the implications for medical practice, environmental regulation, and medical education. Next slide. And so today we have two very exciting and informative speakers who have a lot of experience in this field. Dr. Pablo ndez-La, who is a PhD, and Dr. Sateesh Sakhamuri, who is a physician. And so I am going to just read out their bios to introduce them. So first of all, I'm going to introduce Dr. Pablo Mendez. He's currently an associate professor at the University of Puerto Rico, where he's in the Department of Environmental Sciences in the Graduate School of Public Health. He's an active member of the Puerto Rico Climate Change Council and one of the 6 scientists nominated by the governor of Puerto Rico and confirmed by both the Senate and the House of Representatives of Puerto Rico for the Executive Committee on Climate Change Adaptation Plan. Pablo is currently a PI and a co-PI on the NASA research projects that explores new technology in ways that benefits all segments of the socio-ecological and technological systems for applying Earth's observing data and remote sensing to research in public health and vulnerable populations. Recently, he served as the chapter lead for the US Caribbean chapter at the 5th National Climate Assessment and the US Global Change Research Program. Welcome, Dr. Pablo Mendez. And then our second speaker is Dr. Sateesh Sakhamuri, who is a consultant pulmonologist at the Medical Associates Hospital in Trinidad and Tobago, and also an honorary consultant at the Cora Chest Hospital and the Eric William Medical Sciences Complex, also in Trinidad and Tobago. He's a past lecturer at the Faculty of Medical Sciences, UE, and a president of the Thoracic Society of Trinidad and Tobago. He's an advocate and assembly member of GINA and GOLD, the Global Initiative of Asthma and the Global Initiative for Obstructive Lung Diseases. He's a collaborator of the Global Burden of Disease Study, a fellow of the American Thoracic Society, the American College of Chest Physicians, and the Asia Pacific Society of Respirology. He's an editorial member of the Frontiers Medical Journal and a reviewer of several leading respiratory journals. He's a member of the National Burden of Obstructive Lung Diseases, the BOLD study in Trinidad and Tobago. He's an author of over 40 articles that have been published in different peer-reviewed journals. And of course, he wants to tell you a little bit about 2 of his very big studies that he did today. Welcome, Dr. Sakhamuri. So we're going to start with Dr. Mendez. Thank you, Dr. Mendez.
Hello, Paula, can you hear me?
Correct. You can hear you correctly. So you can go
Perfect.
ahead, Doc, and share your screen.
I will right now. Let me take a look at that. Can you see my screen?
Yes, but you need to put it in presenters mode, please, Doc.
Can you see it now?
Yes, perfect.
Okay, and how can I take out of the screen this? Okay, it's going along. Perfect. Okay, so first of all, thank you for inviting me. I'm very happy to be here. Can I close this? I think so. Yeah, okay, perfect. So thank you again and congratulations for, sorry, can you see me now or can you hear me? Okay.
Yes, looks good.
Perfectly. We can hear you perfectly, Doc.
Sorry.
Sorry, and everything is perfect. You can
okay.
just go ahead.
Okay, so I'm Pablo Mendez, as Pablo mentioned. I'm born and raised in Puerto Rico, and in this case, I will share with you some case studies that are more related with natural sources of air pollution. And in this case, we are considering Saharan dust and one of the potential sources of air pollution for the Caribbean region, but paying attention in this case as a case study from Puerto Rico mainly. But before jumping into that, I would like to give a short overview of what is happening with the climate. Probably most of you are aware. Planet Earth is warming since the last couple of 100 years. It's faster than usual. Nowadays, it's called human-induced climate change. Because it's human-induced, because it's very related with the greenhouse gases, the air pollution since the Industrial Revolution that occurred a couple of 100 years ago. So that is created an imbalance, an energy imbalance in planet Earth. So nowadays, the planet is retaining more energy that it can help if you want. So, and that energy is mainly being translated into heat. And that's the reason why we are getting warmer all year long. More recently, we have been breaking new records and consistently, which is worse for all of us that live in the northern hemisphere of planet Earth, is that the northern hemisphere is getting warmer faster than other places in the world. There are a couple of reasons why that is happening. Some of them is because you have more land surface areas. Almost 75% of the land surface areas is on top of the equator in the northern hemisphere. So the southern hemisphere contains 75 to 80% of the water masses of the world on the ocean. And so the other thing is that most of the industrialized countries that are emitting and continue to produce greenhouse gases that responsible for the greenhouse effect that we are suffering, most of them are in the northern hemisphere as well. So, and also we have more population, so more consumption in that area that also require more energy, and that energy is translated into, again, air pollution, because we most of the places are still creating energy burning fossil fuels. So the second region that is getting warmer is the tropical region. So that's another concern, because in our case, those of us that are living in the Caribbean region, so the Caribbean islands are on top of the equator. So we're part of the northern hemisphere, right? So if the northern hemisphere is the place where we're getting hotter the faster, the tropics and the Caribbean regions, and one of the places that are in second place in terms of ranking in how fast is getting warm out of region in the world. In that context, meaning that hit again, that's a way on how you translate the energy imbalance in the world. And that energy imbalance, then it manifests in different ways, right? So producing drought in some areas, producing extreme flood in some others, producing a very powerful storms in another regions, as it can happen also in the Caribbean region as well, extreme heat episodes, wildfire, as it happened in Russia and northwest of the United States, powerful and more frequent tornadoes, and so on. Coastal flood, storm surge, and so many other ways on how this energy imbalance can manifest through extreme weather events because of the energy that the Earth is retaining, right? And is unable to send it back to the atmosphere, right? So, and one of the things that is affecting also our region that is related, is not necessarily related with climate change, but because of the climate change, things might be obviously changing. And this kind of hazard that is a natural source of air pollution that is mainly coming from the other side of the Atlantic, that we call the Saharan dust, is also being affected by the dynamics, the atmospheric dynamics and the conditions on how the atmosphere is changing, and also presenting a public health for the Caribbean region. So when we're talking about climate change, I'm always insisting that not only looking, it's not enough to just look at the extreme weather events, intensity, duration, and frequency of all of the different storms, heat waves, wildfires, but it also, we need to take a look at the different inequalities where we live, because what is happening is that climate change is already, what it's doing is exacerbating the conditions on how people are already living. So all of the racial equities, the racial inequalities, genders inequalities, social determinants of health, poverty, access to education, those are socioeconomic conditions that are existing prior to climate change, right? But on top of that, then you're adding another layer of problems, which are all of these extreme weather events that are exacerbating the capacity to cope for most of the disadvantaged, underserved, minorities, vulnerable, and sensitive groups. And why is that? Because you might have what are called the climate drivers or the stressors. In the left side, what you're seeing here in the screen is that all of these stressors are interacting also with the environmental and the institutional context. How prepared are our governments, our institutions to address and to cope with climate change? Do we have climate adaptation plans? Do we have programs? What are we doing? And in the right side, what we're seeing is that also the social, the way on how you behave, your age, if you have pre-existing health conditions, if you live below poverty level, if you have access to education, if you have access to healthcare systems, those are also the kind of things to consider when we're facing more extreme and intense and frequent weather events, right? Obviously, elderly, children below 5 years old, pregnant women, people with pre-existing health conditions like cardiovascular disease, respiratory diseases, cancer patients, and so on. There are so many other kind of conditions that are being exacerbated by all of these extreme weather events. And again, as I mentioned, Saharan dust is only one of them. It's one grain, literally. It's one particle on what we call climate change, right? So going directly to the case study that we have been working for the last 4 to 5 years is developing an early warning system for Puerto Rico and U.S. Virgin Islands mainly, but it also have a chart or a map of the Caribbean region. So what we did is that very quickly after Hurricane Maria in Puerto Rico back in 2017, we created a team and we gathered a couple of ideas, and we were wondering the possibility of developing an early warning system for Saharan dust arrival into the Caribbean region. And in order to do that, we worked with 3 different working groups. The first one that was called Resilience, Public Health, and Wellbeing. The second one that it was responsible of characterizing the particles on the ground level using weather stations and meteorological stations and some other kind of stations to measure these particles. And the third one that was responsible of developing this decision support tool, which is a visualization tool to try to help not only federal agencies, which are responsible in Puerto Rico to monitor and to advise about the weather conditions, but also the Department of Health and the general public. So the core team, I always like to recognize that this is not Pablo's work alone. This is also a teamwork. So this is very important to recognize. In most of the cases, you're not able to do these kind of things alone, right? So I would like to recognize that I'm always working with a very powerful team, very diverse and very enthusiastic. So what is Saharan dust? For those of you that probably are not aware. So Saharan dust are mineral particles that are coming from the African continent, mainly from the Sahara Desert and the Sahel Desert. And it can contain mineral, organic matters, marine salt, viruses, and bacteria, right? These are small particles in the atmosphere. They can provide essential nutrients to essential ecosystem, sensitive ecosystem, marine ecosystem, ocean ecosystem, but also terrestrial ecosystem. But in the case of public health, this dust particle can be, in some cases, small enough to get into the respiratory system, right? And the Saharan dust has been associated in some of the islands in the Caribbean region with respiratory conditions for asthma, emergency room visits, and hospitalization in different islands. Saharan dust have a seasonality. This is not something that is occurring all year long. So it's mainly occurring during the summer of the Northern Hemisphere. So it's interacting also with all of the different tropical storms and other kind of phenomena that are occurring also during this season. So you will see the peaks of the Saharan dust during the May of June, July, and then it will continue to decrease until we get until the winters, right? So as I mentioned, you have two main different sources of air pollution. And one of them is the anthropogenic air sources of air pollution, that are coming from transportation, industries, grounds, and airplanes, also marine transportation, agriculture, and some other kind of sources, right? And in the other side, you will have natural sources that could be, for instance, volcanoes, desert dust, natural dust, allergens, mold, spore, pollen. All of those are also natural sources of air pollution. So when these natural sources of air pollution are present in the atmosphere, it means that they are not alone in the atmosphere, and all of a sudden the atmosphere is clean and out of the different anthropogenic emissions. So these natural sources of air pollution are also interacting or exacerbating the conditions of air quality that are as a result of the emission from industries, transportations, and all of the others, right? So that's another thing to consider when we're talking about natural sources of air pollution. And actually, it happened in Puerto Rico. When we were measuring Saharan dust in Puerto Rico, this Saharan dust peaks, and the season is also one of the highest season for diesel particulate matter in some areas of Puerto Rico. Mainly in the seaports where we receive a lot of ships, but also because we have the energy plants that are burning fossil fuel during the summer, and we're burning more energy in trying to produce the amount of energy that the population requires during heat waves. So there is also an association on peaks of diesel particulate matter and also the arrival of Saharan dust. It doesn't mean that the Saharan dust is bringing diesel particulate matter, but it's also a causality. It's not a causality, sorry. It's only an association that is occurring because of the situation on how we are producing energy. To the very specific dust storm that we received in the Caribbean region, most of you have probably remember in 2020 that we suffered one of the worst Saharan dust arrival into the Caribbean, and it was called Godzilla dust event. In the case of Puerto Rico, what we're seeing here is a climatograph in the left upper panel of the screen. You're seeing a time series from 2013 up to 2020, and in the black line, you're seeing the year 2020. You can see the peaks and the highest values are on black, and that was Godzilla, right? So Godzilla was an extreme dust event that arrives to the Caribbean, and it lasts almost for 3 consecutive days with unhealthy conditions in terms of air quality. So what we did is that we wanted to measure absolutely the impact, not only wanted to use the satellite images to monitor and to predict and to forecast the arrival of the Saharan dust to Puerto Rico, but we also wanted to measure the impact. These are just a couple of examples. I will pass very quickly. You can see the different images at the same time, different days. You can see clear skies, and then below you are seeing very foggy in the same Guanica Bay, and in the other one is a view that you're seeing from the mountains in Puerto Rico to the north side of the island, and you can see where the visibility decreased less than 1 mile in some cases. So we quickly get a survey together, and we, with the help of different institutions, we had a participation of 1,500 people that answered the survey. And we wanted to explore if actually this arrival and this dust that was getting to Puerto Rico, this is a qualitative approach, but it was very useful to understand the different risks, perceptions, and barriers that the people are confronting when we're talking about these kind of hazards. Obviously, as is happened also with other kind of extreme weather events, the most sensitive groups are going to be the ones that are going to be more interested about the topic, and also the ones that are going to be most impacted by this kind of hazard. So we submitted a survey, 1,500 people participate. Most of them were women in this case. And at least was interested, at least 65% had a history of at least one chronic condition. But what it was very shocking is that almost 90% of them indicate that Saharan dust affect their health status and both responders and their family members. And one of the most reported conditions during this Godzilla dust event was asthma, with 55% of the respondents. So, and the most reported conditions after asthma, well, eye irritation, coughing, nose irritation, gush irritation, shortness of breath, and fatigue. We then did another kind of analysis, and we say, okay, so wow, we know that in other places of the world, Saharan dust, these kind of particles in extreme conditions could be exacerbating also. Can be a potential risk to exacerbate or to those people that are vulnerable, right? So we did a statistical analysis with mortality, and what we found is that actually for some kind of conditions in Puerto Rico, AOD is a measure and an index that we use from satellite images to measure aerosol in the atmosphere. So AOD is highly correlated with an increase in mortality with ischemic heart disease. I'm not a physician, right? I'm a natural scientist. I've been working in environmental health for 14 years. But what I quickly get in contact with our medical doctors that we have partners. So we have cardiologists, we have pulmonologists, and we quickly get a meeting with them in order to how to explain this kind of information. And what they were telling us is that actually when this kind of dust particle is fine enough to obstruct your respiratory system, then your heart is doing more effort to continue pumping blood into your system and trying to oxygen, right? So probably one of the reasons why there is an association between an increase in mortality when you have a huge peak during Saharan dust, as it happened with Godzilla dust event, and then ischemic heart disease. So you're not seeing, the signal is not that respiratory conditions and people with respiratory sensitiveness or things like that in Puerto Rico are being affected, but also other kind of patients are being affected by natural sources of air pollution in this case. So, and you can see it also that it happened when we adjust the information for age and years of death. So this is very shocking because we were not expecting to see a high number as we saw. So with this information, we say, okay, so then we need to move to the third working group. And the third working group was responsible of designing a decision support tool aiming to work with federal agencies and the Department of Health to provide as much accurate information to the population. So after meeting with patients, focus groups, doing interviews and surveys, after doing key informant interviews with physicians, medical doctors, up to 11 different medical doctors island-wide in different parts of the island in Puerto Rico, we came with the idea of creating this kind of early warning system, which is, again, is supporting information. And we developed a few a risk level in order to notify the population about the level of risk associated to aerosols, not considering, obviously, all of the different kinds of pollutants in the atmosphere. So in this case, is specifically considering aerosols in the atmosphere in 4 different regions in Puerto Rico mainly. This is a prototype, so we call it like an experimental tool. It's now operational at the level of Puerto Rico. So we did a couple of webinars with the National Weather Service in order to educate the population on how to use this kind of tool, the kind of information that we are providing, that we are not we are not medical doctors in this case, but we want only to provide as much accurate as information in terms of the weather conditions that are associated with the concentrations or the level of aerosol in the atmosphere. So for the population and the general public to take precautionary measures and whatever they need to do to protect themselves. And in order to do that, then we create in the left side, these are some kind of infographics with a few recommendations that we did, but also these recommendations are coming out from visit of medical doctor that we did with them. So this is not something that we as scientists are issuing to the general public and to the agencies. So we validate all of the different recommendations with the physicians that were part of it. I'm publishing here the Spanish version, but we also, in the case of Puerto Rico, because we're serving also to Virgin Islands, we publish all the information also in the English version. And
Doc,
we have
you have 2 more minutes, okay?
Perfect. I'm just finishing. I think that this is my last slide. It was a pretty good opportunity because we have an impact of almost 4,000 people reached on Facebook Live. We had a collaboration with Ecoexploratorio Science Museum. So they help us to do the outreach. So we believe that we impact, again, thousands of people on how to use this kind of tool and how to protect themselves. In terms of further consideration, so we still need to have a better understanding of how those clouds are affecting health. We have some correlation. We have some different kind of methods and approaches. We have qualitative approaches and we have quantitative approaches. And in both of them, we are validating that actually the people is being affected by Saharan dust in Puerto Rico. But we still need to better understand those kind of associations, right? So we still need to work and to continue working on watches and advisory process to improve what we have. And that's it. I think that at least what we have done have been very useful for practitioners and stakeholders and the general audience in terms of protecting themselves from natural sources of air pollution, Saharan dust. That's it. I think that right on time, right?
Perfect. Thank you so much, Dr. Mendez.
Thank you.
That was very interesting. I don't know if I'm supposed to feel scared or hopeful, because after you mentioned that Godzilla affair, and most of us have had an opportunity, those of us who live in the Caribbean in 2020, when we saw the sky go dark and we didn't know what was happening, we thought maybe a hurricane was coming, but no, it was the Saharan dust giving us that. And then you mentioned this is the time, the June, July months, when we have the Saharan dust coming in and having higher levels. It's also the time for hurricanes and for major disasters. But at least you gave us some hope because of the research that your group is doing in finding out how people are being affected by these effects, and what you're doing in terms of developing the early warning systems and giving people some advice on how to deal with these things early. So at least there is some hope for us. And once you get this information in terms of the environment, it will also help doctors to connect the dots. So then we would have no excuse. We would know exactly what to do to help to protect the public. And as you said, it's not just respiratory illnesses, and I guess that's what Dr. Sakhamuri will be expanding on, how this is also affecting other organ systems. But before we go on to Dr. Sakhamuri's talk, I would like to welcome everyone, because we have people here from the Caribbean, from Haiti and Jamaica, all the way down to Guyana. But we also have people from South America, from Argentina and Colombia, from North America, Chicago, Richmond, California. And we have people from Africa, the Cameroons and Ghana, sorry. So that we have a very diverse group here. And so I would like to welcome you and thank you, everybody. We have actually a global population here. Thank you. I'm not seeing any questions directed to Dr. Mendez right now, so let us go right ahead. And we're going to ask Dr. Sakhamuri to come on and chat, and maybe by that time, people might have a few burning questions. We could bring it up. Okay, so Dr. Sakhamuri, you're on. Take it away.
Thank you. Let me upload my slides. Sorry. Right.
Okay, great.
Right. Hope you're all seeing my slides.
Yes, perfectly, Doc.
Okay, thank you.
Take it away.
Good evening, everyone. I would like to thank the organizers for conducting such an important educational workshop, and thank them for giving me the opportunity. So I'm a pulmonologist based at Trinidad and Tobago, practicing here for more than 2 decades. So today I will focus on the climate change and its impact on the respiratory diseases. So we all breathe about 10,000 liters of air every day. And you know, the lung is the first a defense mechanism, a defense organ that exposed to the effects of the climate change or the air pollution. Right, so last month, let me minimize, okay. So in the last month, we have published a paper in the Lancet eClinical Medicine. As a member of the Global Burden of Disease, Chronic Respiratory Disease collaborators. So we published this data last month. So 1 in 20 people globally suffer from chronic respiratory diseases. So that includes asthma, COPD, interstitial lung disease, sarcoidosis, and many other. And importantly, the chronic respiratory diseases were the 3rd leading cause of death, right? And contributing to about 4 million deaths. And they have a prevalence of about 455 million. And among them, the asthma was the most prevalent one, so about 262 million. So the prevalence of chronic respiratory diseases have increased by 40% when you compare the data from 1990 to 2019. And similarly, the deaths related to chronic respiratory disease also increased by 29%. So in the same paper, we have highlighted the several risk factors contributing to the chronic respiratory disease related DALYs, disability adjusted life years. So out of the 11 risk factors, 4 of them are related to the climate change as well as air pollution. So how climate change can impact the respiratory health? There are 3 important mechanisms. One is the increased surface temperature. Second one is extreme weather events. And third one is, most important one is air pollution. So increased surface temperature can increase the ambient ozone levels. You all know that ozone is important to protect us from the UV radiation from sunlight, right? But if its concentration increases at the ground level, it can cause a lot of respiratory problems, right? Similarly, the increased temperature can also rise the concentration of pollen and various other bioallergens. Extreme weather events like droughts and wildfires, they can increase the carbon dioxide as well as particulate matter levels. And floods and hurricanes, the humid and moist circumstances can increase the fungal growth in the environment. So the components of air pollution include particulate matter, carbon monoxide, nitrogen dioxide, ozone, sulfur dioxide, and lead. So they can all impact the respiratory health. So what are the likely the impact on the respiratory health? So a climate change can lead to the onset of airway and allergy diseases. That includes asthma, COPD, allergic rhinitis, and various other conditions. And they can also worsen or exacerbate the existing lung diseases. The climate change can increase the infection outbreaks, including several viral as well as COVID-19. There were several papers published on this topic, and we have written some a commentary in April 2020. So in the early days of COVID, we published this paper in the BMC journal. Subsequently, there is a significant amount of evidence has been published. So climate change can increase the risk of the infection outbreaks, viral, bacterial, fungal, and all forms of infections. They can also worsen the occupational pulmonary disease disorders, right, including pneumoconiasis, various other conditions like occupational asthma and COPD. So climate change can also lead to the progression of interstitial lung diseases. So interstitial lung diseases, we usually call them as lung fibrosis, right? So they're caused by autoimmune diseases or environmental exposures, or sometimes without known reasons. Then we call them as idiopathic lung diseases, idiopathic interstitial lung diseases. So climate change can also increase the lung cancer risk. So about 14% of the lung cancer can be attributed to the climate change, right? So that's why we are seeing the increasing incidence of lung cancer, even in non-smokers. And interestingly, the climate change can also impact sleep disordered breathing. That includes sleep apnea. So it can also raise the blood pressure, pressure in the lung blood vessels. We call it as pulmonary hypertension. And it can worsen the post-lung transplant events, including infections, as well as rejection of the transplant, lung transplant, right? And importantly, exposure to the climate change and its the factors can compromise the development of the child, the lung development especially, right? So there is ample evidence on these the climate change impacts. Right, so moving on to the next slide. Right, if you look at the global risk factors for death, so currently the air pollution is at the 4th place, nearly contributing to 7 million deaths annually. Right, so, and similarly, furthermore, if you look at the air pollution, it is reducing our life expectancy nearly by 2 years. And out of them, the particulate matter of 2.5 is the major contributing factor, right? Followed by household air pollution. Right, so the global deaths attributable to air pollution. So the 40% of the current COPD deaths are attributable to the air pollution. Right. Similarly, about 30% of the lower respiratory tract infection deaths are attributable to global air pollution as well. 20% of diabetic deaths, ischemic heart disease, lung cancer, neonatal deaths, and stroke-related deaths are also due to probably due to air pollution. If you look at the impact, age-related impact, unfortunately, children, young children, and elderly population are being affected by air pollution, right? So, and if you look at that, ambient particulate matter is the most important factor leading to this mortality. What about our country, Trinidad and Tobago, right? So air pollution was among the top 10 risk factors for death and accounting nearly 8% of all deaths. And air pollution is reducing our life expectancy by 1 year. And the particulate matter, PM2.5 levels are increasing. And Trinidad and Tobago ranks first in 19 Caribbean countries in terms of the PM2.5 burden. So, and some other important facts So over the past 2 decades, the air pollution related mortality has increased by 66%. And if we don't intervene over the next 3 decades, the number of persons dying from air pollution may exceed by 100 to 300%. So according to the Global Burden of Disease study, air pollution is responsible for about 4.6 trillion US dollar loss and 8.1 trillion US dollars loss due to the overall health damages. And most of the damage is happening in the low and middle income countries. So what are the major sources of air pollution in Caribbean? So vehicle emissions, fossil fuel use for electricity generation, industries, open burns. We have a culture of burning the farm waste and the grass as well. So that is contributing significant air pollution. Indoor air pollution, dust storms, right? So as Dr. Ndez-La mentioned, so Sahara dust is one of the contributing factors. You can see one of our landfill site close to our capital city, Port of Spain, right? The burns, the open burn contributing, leading to the air pollution in Port of Spain city, right? So we need to regularize such practices. So Sahara dust. So we published this commentary about 4 years ago in the Lancet Planetary Health. So there is increasing intrusion of Sahara dust. So it is a cause of concern. Of course, we need more evidence. There is ample evidence thus far to support its impact on the allergic diseases as well as airway diseases and the infections, lung infections as well. So in 2021, the WHO updated their air quality guidelines, and they have listed several air quality related parameters. The most important one is the PM 2.5. If you look at the update from 2005, so now the latest guideline recommends the maximum threshold is 5 micrograms per meter cube. Similarly, they have reduced the threshold levels for other factors as well, including PM10, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide. Right, the particulate matter. So Dr. Pablo already mentioned about this. So it's, if we look, we classify the particulate matter based on the size. So PM 2.5, we call it as a fine particulate matter. This is more important than PM10. PM10 can only reach up to the major airways or the upper air respiratory tract, but PM 2.5 can reach to the peripheral airways and can also enter the circulatory system. So it affects on the respiratory as well as cardiovascular health is very crucial. So, and if you look at the PM 2.5 current levels globally, right? So they're significantly higher than the WHO defined air quality guideline level. And if you look at the Caribbean and Trinidad and Tobago, as I mentioned earlier, Trinidad and Tobago is leading in terms of the PM 2.5 burden. So the next important air pollution factor is the tropospheric ozone, right? So ozone is important in the to prevent the UV radiation, but if it concentration increase at the ground level, it can lead to mortality. So this was a data published in New England Journal of Medicine about 15 years ago. So it has shown that for every 10 parts billion increase in the ozone exposure, the risk of respiratory disease related death has increased by about 3%, right? So, and the next factor, important factor, is the household air pollution. So annually, about 3.2 million people are dying with household air pollution due to household air pollution. by using kerosene, solid fuels, and the various, the stoves that we use. These are the different models of stoves they use globally. So household air pollution is also an important factor, right? If you look at the proportion of population using solid fuels, nearly about 50% of the global population still using solid fuels. And Caribbean is not far from the global burden. So we have nearly about 40 to 45% of our population using the solid fuels. Right, what about cooking gas? Is it clean? So there was some sensational article published in Bloomberg media. So recently questioning the safety of the gas stoves and a potential ban on them. So based on the data, if you look at the United States cooking gas, so they mostly use the natural gas, right? Which has significant amount of methane, right? So it is a greenhouse gas, is about 90 times potent than the carbon dioxide. So, and also any form of cooking gas, they can produce a significant nitrogen dioxide, which can act on the airways and can cause airway inflammation and bronchospasm. And I don't think I have to highlight the importance of PM 2.5. So we get a significant amount of nitrogen dioxide and particulate matters from the cooking gas as well. So, and this was a meta-analysis published about 10 years ago, including about 19 studies. And what they have shown, having a cooking gas using in the house can increase the risk of asthma by 32% in children, right? So it's a significant finding. Right, so if you look at the energy ladder, so the solid fuels are the worst sources of the indoor air pollution. And even among the non-solid fuels, kerosene is is also can lead to significant indoor air pollution. But the safest form of cooking is the electricity. So we need to do some research and look at the impacts due to the indoor current forms of cooking gas. Right, the climate change and asthma. So climate change can impact asthma by spreading aeroallergens, due to the heat waves, the airways can develop inflammation, droughts, floods, wildfires, and thunderstorms. They can also increase the risk for asthma.
Excuse me, Doc, you have 2 more minutes, okay?
Okay, yeah, I nearly finished, thank you. So thunderstorm asthma is very popular. It's a rare occurrence. About 26 epidemic events are reported in the literature. About 11 of them were reported from Australia, especially from Melbourne. So it was mostly due to the ryegrass pollen release. And interestingly, it was reported more in the Asian or Indian ethnic descent. So air pollution and asthma. So ozone, nitrogen dioxide, sulfur dioxide can worsen the asthma by increasing the inflammation and causing bronchial constriction, and by also impacting the genes, right? So they can induce asthma in a general population, and they can also exacerbate the asthma. Right. So a long-term exposure of general population to air pollution leads to increased risk for asthma onset. Whereas in asthma patients, even a short-term exposure to air pollution can lead to worsening of symptoms, emergency visits, hospitalizations, and even death due to asthma. And some of you might know Ella Adu Kisi Debra, a 9-year-old child, suffered from a severe life-threatening asthma and unfortunately passed away in 2013, February, I think. It was due to the air pollution exposure. And the court has given a sentence that the air pollution was a cause for a demise. And this is the first such a verdict given in Europe as well as in the world. So there are many mitigation strategies. Due to the time limit, I can't go through all the strategies, right? So the conclusions, the relationship between climate change and air pollution levels and respiratory events is supralinear. Access to clean air should be recognized as a fundamental civil right. Legislation is warranted to safeguard against detrimental impacts of climate change and air pollution. Educating general population, healthcare workers, and policymakers is crucial, and there is an urgent need for further research. And notably, in the last year, the United Nations unanimously approved this right to healthy environment. And of course, we have more to do to address the major task. Thank you very much.
Thank you very much, Doc, for that very informative discussion. Now we know we have to keep our eyes on PM 2.5 because it's not only going to cause respiratory illnesses, but it's also going to worsen our chances of getting cancer. It is going to affect the newborn pregnant woman, and it's also going to cause other diseases like heart diseases, because this can actually get put into the body, not just stick of the lung because of PM10. So we need to pay attention to that. But we have one question for you, Doc. Someone wanted to understand the correlation between sleep apnea and climate change. So if you could just give us a brief understanding of that.
Right. So the mechanism has not been well established, but there are some hypothetical proposals. So change in the temperature as well as change in the air quality can lead to the inflammation in the upper airways, especially in the throat, as well as it can lead to the change in the redistribution of the fluid in the supine position as well as in the sleep, during sleep. So it's multifactorial. It has not been well established, but most likely factors are due to the upper airway inflammation and swelling in the throat.
Okay, that makes a lot of great sense.
Yeah.
Okay, so we have no other questions. Somebody asked a question, but it was answered very comprehensively in the chat. So we can go on now to the work group presentation with Abigail Liverpool. Welcome, Abigail. You can share your slides. Thanks.
Hi, good evening, everyone. Okay, let me just get my presentation mode. Okay, good evening. I am Abigail Liverpool. I am presenting this work group assignment on behalf of work group 2. And sorry, I'm just getting a bit hoarse now. Yeah. Thank you so much for joining us this evening. I know our 2 keynote speakers, they have aptly presented the impacts of climate change on respiratory diseases. And our task as a work group was to develop some materials so that you can use continually to give you, so that you can be more informed and how to address climate change and respiratory disease. So what we would have done as a work group is to create an app, which is called the Breathe Safe app. And my task is to go through how the app was developed and how it works. Okay, so these are the development steps of Breathe Safe. First, we selected references relating to climate change and respiratory diseases. And from those references, we were able to identify information on some medical condition profiles, look at the vulnerable groups, what are some accessibility to healthcare facilities, some risk factors, and other exposures. Having that information, we selected from the JOT form platform, the app which we use to develop, to share the information. We created a form based on some key information that would help persons to gather information and how to develop their medical profile. We created some form of primary medical respiratory conditions. We identified, some primary medical respiratory conditions linked to climate change. And thus the app, they were all included in the app with reference to some tips and resources. So the app is structured with 10 sections. It gives a description page of the app. It has a self-assessment form. It also shares links to resources. It has a toolkit. If some resources that were produced during our past climate change and NCD's presentations. It has a feedback section. It has the Earth Medic Earth Nurse Pledge and also a mode for contacting us. So this is what the app looks like. This is the description page, the first page when you click on the app. It has a menu, and on the menu, it shows the different tabs that can be accessed to the information. Following the app description, there's a self-assessment, and it's a simple form where some important information is gathered, and it also asks questions regarding risk exposure and symptoms, which a person can use to develop their profile. Following the self-assessment, there are resources. And in the resources section, we have information on asthma, COPD, heat stroke, rhinosinusitis, and other respiratory conditions. So here is one of the tips that was produced for asthma and sinusitis. So it gives a list of some of the preventative measures that persons can take if they are susceptible to asthma. And then there's the toolkit. This toolkit was developed to share more educational materials, and most of it was taken from the presentations that were done in previous sessions like these, when we would have developed infographics on climate change and mental health. There's also climate change and cancer. So those information can be found on that page. And then there's the feedback section. Because most of all, if we develop something, it's very important to evaluate and to get feedback on how well it works and how it's appreciated. So in that section, persons are able to rate and give feedback, and also share any testimonials that they would have had in using the app. And then there's the pledge, the Earth Medic Earth Nurse Pledge. It says, I am a medic nurse. Climate change is a health crisis. A push for the world to start anew. I pledge to improve my health, our society, and my planet. I am a medic nurse. And I hope you would have taken the opportunity to say that pledge with me, as we all participate on this platform to show our support and to inform and to share knowledge on climate change and health. And the final section is the section to contact us. And when you click on this section, it gives access to the email form that can be filled out to send any message to the platform. But how can you receive this app? So yes, here is the app. It can easily be accessed by scanning a QR code. When the code is scanned, it gives you the option to add on your home screen, whether it's on your mobile device, and there it can be easily added, and just simply clicking on the app. It takes you through the menu, which would help you to navigate the app. And I think at this time, Haley would be sharing a link to the app in the chat, so you can just go ahead and try it out. And this is Breathe Safe. And we would love your feedback at the end of this to see how we can further improve this app. Thank you.
Thank you, Abigail. Thank you. The app is really a great way to spread the news, and also it's so informative. Okay, so in the essence of time, we're going to go right into the breakout sessions. And so I'm going to ask Haley to post the 3 questions. Okay, so the 3 questions, right? Easy questions, right? But how we're going to do it, you're going to go into the breakout sessions. We ask, once you're there, please elect one leader who will be taking notes. And then that person would be feeding back to Carrie Ann the highlights, the notes that would have been collected. Okay, so everyone would be answering these 3 questions, right? So in your country or in your local community, we are looking for the causes of poor air quality that would be contributing to a worsening of respiratory disorders or any kind of health disorders. Are you aware? The second question is, are you aware of any regulations, including governmental policies, to monitor or control unacceptable levels of pollution? And then we want to look at knowledge gaps. What do we need to know, and what is needed to close these gaps? So these are the questions we'll be discussing. And right now we are going to go into breakout groups.